I'm the director of the Wound Care Center at Temple University School of Podiatric Medicine. I've been the director since 1999, but I've been working there since 1992 when I first came from Vermont in private practice, came down to the podiatry school, began to teach in the Department of Orthopedics, gradually worked up to becoming chairman of the same department, and then relinquished that to put more time into the wound center a couple years ago. So I've been there a long time now, and we lived in Philadelphia. I did all my training in Philadelphia. Went to the University of Pennsylvania, and then went to the Pennsylvania College of Podiatric Medicine, which is now Temple University's podiatry school. We treat wounds of the lower extremity, primarily diabetic neuropathic, venous leg ulcers, and arterial ulcers of the foot and the ankle, some lower leg. Venous leg ulcers tend to be lower leg. Compression therapy has been around a long time. The sophistication of compression therapy has changed greatly in the last few years. Compression therapy I think it's very effective at reducing edema and preventing recurrence of edema in patients that have movable fluid. It's not as effective, obviously, in lymphedema or people with a lot of fibrosis, which is kind of hard legs or legs that have a lot of scar tissue in them. But if you have fluid that's kind of loose and movable and can be removed by the lymphatics or the venous system, then the compression pumps, segmental compression pumps and wraps work extremely well. There are a lot of levels at which edema control works. They used to think of edema as just getting the fluid out of the leg and getting the swelling down. But so many things are associated with the buildup of fluid in the leg. One is when there's too much fluid in the leg or too much fluid in the outflow system, nothing can get in. It's like squeezing a hose at one end, and then the fluid comes down and it can't get through the other end, which is closed. So in order to make sure that a limb has good blood flow, good arterial flow in, good flow of fluids around to the cells and to the other organs, and then good fluid exit from the limb so that the waste products that are created by metabolism and other things going on in the limb are removed, you have to have good, you can't have a lot of edema in the leg, so you have to have good removal of that fluid. That's done by two systems, the venous system and the lymphatic system, and pumps help both to eliminate fluid from the leg. When you eliminate fluid, you reduce kind of the back pressure in the surrounding tissues to a wound, and you actually increase the microcirculation to the surrounding wound. All wound healing happens at the edge, and it heals inward toward the center. So if you can reduce the pressure at the edge and increase blood flow at the edge, then you'll see increased healing in the wound. Everybody has edema. Whenever you have an injury, you'll have some level of swelling or edema in a wound. Whenever you sprain your ankle, obviously, you have lots of edema, lots of fresh edema. But if you have a wound, or either a traumatic wound or a chronic wound, or you have a condition where there is deoxygenation or some sort of trigger to the inflammatory healing process, you will then have an edematous response in the vascular tree, and you will have a fluid buildup. And if you can't handle that fluid, which a lot of people can't, a young person's system is overwhelmed by the amount of fluid produced by a sprained ankle, so the ankle gets real puffy and big, which is connected also with pain. A lot of the reason why things hurt is because they're swollen. So if you reduce the edema, you reduce the pain, you increase the good circulation, and you decrease the blockade to healing, and wounds will heal faster, tissues heal faster, pain goes down, and the patient just gets better quicker.